Oh, hey everybody, it's Dr. Joe and Running Remy, and today I'm going to show you my 7 best knee pain exercises for beginners. So let's show them how it works. Disclaimer alert, disclaimer alert. So these exercises for beginners are going to be pretty simple, maybe what we would call acute exercises in therapy. So you're not able to do a whole lot of movement yet, but you just want to start activating the muscles and getting them moving. So the first one is going to be what we call a quad set. And so basically you're just trying to squeeze the muscle without any movement, or some people call them isometric exercises. So I'm using just a little foam roll underneath my knee. You can roll up a towel just to give yourself a target. You don't have to use anything, but I always feel like if you have something underneath, it's easier to push into. And so all you do with a quad set is just kind of what it sounds like, is you're setting that quad or squeezing this quad muscle. You want to keep your heel down, so it's not coming up like this. It's keeping that heel down and just almost trying to squish that knee into the roll by squeezing that quad muscle. So I'm trying to straighten out that knee as much as I can. While I'm squeezing, I'm going to hold that for about 3 to 5 seconds and then relax. So that's just starting to activate those muscles, but not making a big movement where it would be painful. So again, just squeezing down, 3 to 5 seconds. You can do 10 to 15 repetitions of each, maybe 1 or 2 sets a couple times a day, just to kind of get that moving and get it going. So then the next one is going to be a hamstring set. So that's the muscles underneath there. And so it's going to be the same kind of concept where I'm activating those muscles, but I'm not actually moving the muscles. So this time you want to have your knee kind of bent up and have your heel on the floor. And so really what I'm doing is I'm pushing the heel down into the floor or the mat there to activate my hamstrings here. So you're activating those muscles, but you're not really moving it, so it's not getting that sometimes painful movement that you might have if you're early on in your injury or early on after a surgery. So again, I'm just pushing down, squeezing those muscles for about 3 to 5 seconds, doing 10 to 15 of those, couple sets, a couple times a day. So then we're going to go into the going out, which is abduction. And the way I like to do that in an isometric way is just take a belt. Now you want something solid, so not a resistive band. This is something where you don't want to move because it's an isometric exercise. And just put it just above your knee on your thigh area. You can do it sitting up, but I find that it's a little bit easier to do lying down. It's a little more comfortable for people. So you want your knees to be about hip width apart, so a little bit of space in between. And then this time, you're just pushing out into that belt. Now, again, you're holding it for that 3 to 5 seconds. When you're first doing all of these exercises and you're activating those muscles and pushing, you might only want to do about 25 to 30% of how hard you think you can push, because even though you're not doing big movements, you're activating those muscles that maybe you haven't worked in a while, they haven't done what they were supposed to in a while. So don't start out pushing as hard as you can 100%. Just push out. You don't want to feel pain, but you want to feel a little bit of tension. You want to feel those muscles activating, and then relax that 3 to 5 seconds. Again, 10 to 15, couple sets of those, couple times a day, depending on what your injury is and if your doctor or therapist has cleared you for those exercises. So then the next one is just going to be the opposite. So you're squeezing in for those adductor muscles. And so now you're just going to take a ball. If you don't have a ball like a basketball, soccer ball, volleyball, you can fold up a pillow, but you still want to have your knees at about hip width apart. They can go a little closer and a little further out, but you don't want it to be like a tennis ball or something. You want to have some space in between so you're kind of in that neutral position. And then this time, you're just squeezing inward. Sometimes people feel this a little bit more because those adductor muscles don't get worked as much as they should. So just, again, start off with a little bit. Don't go too crazy, 25 to 30%, holding it that 3 to 5 seconds, 10 to 15, couple times a day. So once you get those working, then we're going to start putting a little bit of movement into it, and I'm going to sit up in a chair to show you that. So now that we've exercised some of the muscles around the knee, the quad, the hamstrings, the IT band area, and the adductors, those all help strengthen the knees. So now we're going to get some movement to strengthen them even more. The calves also come up and cross that knee. So now you're just going to come up with a heel raise and then down and bring up your toes. So you're just going to alternate back and forth. Again, this is for beginners or maybe the acute part of your injury. So we're not putting a whole lot of weight to it, but we're just starting to get things moving, almost pumping the ankle to get the blood flowing and the circulation in the legs. And this also works those calves as well that come up and cross that knee. So again, 10 to 15, couple sets, couple times a day. Then the next one is going to be what we call a seated hip flexion. And even though it's for the hip flexors, those hip flexors have a lot to do with our knees. So it's really important to do these as well. The important part is when you're sitting, it's good to use a chair with a backrest so you can keep yourself upright. But if you don't have the backrest, if you're sitting on something and your back's not supported, try not to lean back when you're lifting your leg. You really want to use the muscles to bring that knee straight up. So you're just coming up like this. And even though it looks like a simple movement, and I like to alternate back and forth, if you have an injury or you've had a surgery or maybe you just haven't worked these muscles in a while, this is going to work those hip flexor muscles. And again, that really helps with the knee. And as you can see, when I bring it up, I get some motion work in my knee as well. So again, 10 to 15 of those. If it gets really easy and you're doing 20, 25 with no problems, you can put an ankle weight around your ankles to get a little bit more resistance to it. And then so the last one is just going to be then what we call a long arc quad. And so now all you're doing, some people will call this knee extension, is bringing up your leg and squeezing at the end. So this is going back to working that quad muscle. I like to pull my toes up at the end. That just gives me an extra contraction of that quad muscle. You don't have to. It also stretches your calf when you come up. But I also feel like that just helps get some motion in your knee as well, especially if it's stiff and tight. But this is a really good one as well to strengthen those muscles because now you're getting movement with the quad. The first exercise we did was kind of an isometrics, and now we're getting some movement with it. And so you can alternate back and forth if you want to with these, or if you want to do them all on one side and then switch and do the other side. But even if you just have knee pain on one side, I'd really work both sides because most likely the other side has been compensating and you want to keep that one nice and strong and don't let it get angry on you too. So those were your 7 best knee pain exercises for beginners. If you'd like to help support my channel, make sure and click on the link up there. And don't forget to subscribe. Where, Remy? Yeah, down there. And remember, be safe. Don't forget your shoes. Have fun. And I hope you feel better soon. Run, go, 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 go.